sorry about that. I'm Lawrence Stuntz. I am the director of the Massachusetts eHealth Institute at the Mass Tech Collaborative. We're a state quasi-public agency here in Massachusetts focused on developing and growing the digital health cluster in the state. And we're one of the sponsors of this Future of Aging track that the panelists will tell you a lot more about, and I touched on last night in the keynote if folks got a chance to see that. But part of the reason why we're super excited about the future of aging is just there's a huge economic opportunity for folks. There are by 2030 there will be about 73 million people here in the U.S., the baby boom generation, who will all be older than 65. The growing cohort of the fastest growing cohort in any age demographic is older than 80. And all those folks have both a lot of need, but also a lot of economic might. And the longevity economy, estimated here in the US is over $7 trillion in terms of the economic output of folks who are over 50 as estimated by AARP. And so you can think of this as both an opportunity to solve great need as well as a great opportunity for companies because there are folks out there who are going to buy the products that you invent this weekend and grow and build over the year. So I'm going to be brief. I just do want to put in a plug. As your teams come together and as you stay together, hopefully after this weekend, if you do have real companies that are getting off the ground, we have a lot of resources at massdigitalhealth.org. So I'll throw that in the chat, or maybe Paul will. But our goal here is to make Massachusetts the best place in the world to grow, to start and grow digital health companies, and in particular companies that are focused on aging. So now I'll turn it over to Duke Collier from Benchmark Senior Living, and he'll give a little bit of an introduction. Benchmark was kind enough to co-sponsor this track along with us.
Thanks, Lawrence. So I'm Duke Collier. I'm Managing Director of Innovation at Benchmark, which is a large senior living company primarily in New England. We have over 4,000 residents, and the average age of whom is 87. They have, as you might expect, an array of cognitive and physical and psychological and functional challenges. And our task is to help them take care of themselves, to help their families take care of them, to help our employees take care of them. And what you'll hear in what I've said is that the problem we are trying to solve is how can we do a better job of caregiving? And how can we help others do a better job of caregiving? Medicine is certainly a distinctive area of care, a distinctive piece of care. We've made great progress in medicine in the last 100 years. But caregiving, it is in many ways the 21st century challenge. And so as you think about your skills and many of those being technical and digital, think about them in the context of how we can do a better job of assessing the needs of care, how we can do a better job of planning for care, how we can do a better job of monitoring the caregiving and the benefits of the caregiving. Those are the problems. How can we do a better job as caregivers? So with that, it's very exciting to me as probably the dean of this panel in age to be a part of an MIT hack, and very excited to hear what all of you are doing in this next day or two. Thank you. So maybe Danielle, I give it to you as our moderator.
Well, thank you, Duke and Lawrence, and thank you to the MIT Hacking Medicine team for convening such an incredible group of people who are looking to innovate for everyone, really. So this is a universal conversation we're having about living longer. So thank you to everybody devoting your weekend, but most importantly for devoting your creativity and your time. And we have an amazing panel here today to help you dig into some of the more complex topics that you're looking at, to bring new insights, but most importantly, to bring some excitement and energy, because there is so much potential in this space. And I'm Danielle Duplin, co-founder of Agency. We innovation community for innovators who are helping to improve the aging journey. And I'll give you a little background on why we built Agency. It actually was from a hackathon sponsored by Sampo Japan about 2-3 years ago. And the catalyst for this hackathon was this one quote: "There are more adult diapers sold in Japan than baby diapers." So just want you to take that in for a moment, right? So we're going to talk about stats and metrics and so forth, but there's when we attach the human implication to a statistic, more adult diapers sold in Japan than baby diapers, there's a lot to unpack there and a lot of opportunity for innovators to change that narrative. So more adult diapers than baby. Well, that means, at population scale, we're aging. The planet is aging. Japan is a aging society. Many countries are following in the tracks. And how Japan solves these issues could be signals and indicators for how the rest of the world solves them. Also means that for any products and services that you come up with, there's a good potential that there's a world market, right? But more importantly, what are we learning from that? Well, we're learning that incontinence is a huge topic to grapple with. And when you think about not only the health issues that represents, and how we could potentially come up with interventions to help with incontinence, it's embarrassing. And it leads to the whole psychology of aging and your own ability to maintain independence and dignity and self-care, and your own agency, right? What also leads to, when you think about who's managing this diaper change scenario, it's first and foremost would fall potentially on family caregivers, loved ones, spouses, adult children. And that just creates a whole different dynamic about what it means to age, and to age in context of your family, in context of the care circle of people around you. And it also represents a trigger moment. Too many episodes of incontinence would lead to a decision or intent to move. And what that means is move from, let's say, a home care setting to an institutional care setting. And it might be that the individual doesn't necessarily require yet all the other services at that care setting, but because of this one trigger event, they move to a more complex care setting that's higher cost and comes with it a whole other set of decisions. So I would love for you all to think about what you're working on, particularly on the problem that you're solving, but also the context, because small interventions could have huge implications and make a huge difference on the lives of not only individuals, but their families and institutions and communities. And in fact, it was a Japanese insurance company that sponsored our first hackathon. So they were looking to diversify their insurance portfolio, recognizing that many of the insurance costs are come out later in life as your healthcare becomes more complex. And they also purchased about 400 nursing care facilities across Japan, and could see the impact of caregiver shortage at scale across 25,000 beds, where folks who were aging, in the institution. But it also meant that they were wide open and willing to partner with innovators like yourselves to pilot and to experiment and to explore and to say, aging is a highly human experience, but we need technology to bridge the caregiver gap, and we need technology to accelerate our understanding and our learning and our overall ability to care for communities who are aging at scale, right? And so from that hackathon, we saw there was such a range of ideas that came forward, much like we just took a quick peek at what you guys are all working on, and there's a huge range. So it could be anything from a public awareness campaign on the impact of loneliness, which we now see is equivalent to smoking 15 cigarettes a day, to something that's very high tech that involves machine learning, data, analytics, and so forth, so we can get ahead of maybe some chronic disease onset, or ways to coordinate care among multiple parties and stakeholders like physicians and providers and family members and remote and distant loved ones, et cetera. So there are so many ways for each of you to have an impact. But what we also learn is that none of these solutions can get to market at scale without the ecosystem and the stakeholders and leaders that are part of this interconnected community. So we're so excited to hear from the panelists today because they represent key aspects of the ecosystem. Robin Lipson from the Executive Office of Elder Affairs on kind of the government policy take on how do you create the environment and the infrastructure that allows innovation to thrive. And we'll hear from Dr. Ipsat Bahia on getting into what it means, to grow older in terms of geriatrics and the psychology of growing older. And then we'll hear from an innovator, Stephen Lee, who actually had a really clever way to apply technology to help caregivers. First, I'd love to introduce you to Robin Lipson. As I mentioned, she's the Deputy Secretary of the Massachusetts Executive Office of Elder Affairs. You'll hear the acronym EOEA. Robin works to promote the independence, empowerment, and well-being of older adults, individuals with disabilities and their caregivers. Robin leads many key statewide initiatives, including Governor Baker's Council to Address Aging and Age-Friendly State Plan, the Massachusetts Healthy Aging Collaborative for age-friendly and dementia-friendly policies, and she is the COVID-19 Incident Commander for EOEA. What I love about Robin too is her straightforward way to say we need to reframe aging. Yes, it's about policies. It's also the narrative about how we talk about what it means to grow older and to do that with dignity and language that reflects that. And then next, so Robin just wave so everybody can see you. And next, we'll also hear from Dr. Ipsat Bahia, who's the geriatric psychiatrist, clinician and researcher. He's medical director for geriatric psychiatry outpatient services at McLean Hospital and McLean Institute for Technology and Psychiatry, excuse me. He's the director of technology and aging lab. His research focuses on the use of tech and informatics in the assessment and management of older adults, and currently oversees a clinical and research program of aging, behavior, and technology. And he's published extensively in major international journals and textbooks, and is award-winning. So indeed, it is going to be the combination of technology and brain science. That's the winning strategy. And then we'll hear from Stephen Lee, co-founder and CEO of IoniCare, where he oversees technology and operations for IoniCare's caregiver support and navigation platform. And he is passionate about IoniCare's mission to encourage, empower, and equip family caregivers through his own lived experience. And he has also spent time at MIT where he met his wife. So there's all kinds of unexpected outcomes that could happen this weekend for each of you. So let's start with Robin. And I present this to each of you. You each represent big parts of the ecosystem. What are you seeing as the major trends in the people that you serve? And what are you seeing as the highest priority unmet needs? So Robin, we'll start with you.
Thank you, Danielle. You always do such a great job of framing up this set of issues for people and inspiring them to think about them differently. So I'm thrilled to be here. And the first thing that strikes me is I am delighted to be on this panel with Ipsat, a brain scientist, and Stephen, who's thinking about how to support caregivers who are sometimes doing the most mundane tasks, like helping people eat or bathe. And I think that when you consider the needs and innovation opportunities in aging, they range from brain science to diapers. And that's kind of an interesting way to think about it. So my perspective on this is that I work for state government in Massachusetts, and the job of my agency is to support older adults who have chosen to age in their community, however they define that. It could be a benchmark community like the one Duke talked about, or it could be their own home or an apartment designed expressly for seniors. And what we think about as people age is they want to maintain their independence, and they want to be engaged, and they want to have purpose. But all those things can be true while at the same time people needing additional assistance or support or an environment that enables them to be as effective and as independent as possible. So we work on things, on everything from providing nutritional assistance to people who may need help cooking or who may need nutritionally delivered meals, to folks who need care round the clock for toileting, bathing, or who may have cognitive limitations and might actually need help getting through their day. So one thing that I just want to point out to you is that COVID and the challenges around the pandemic have really elevated one of the things, actually two of the things that I think the most about. The first is the issue of isolation and loneliness. The flip side of that is being engaged and having meaning and purpose. But people are feeling the impact of isolation much more intensely because of the pandemic. And that has ramifications on older adults. Danielle cited a study that was done, I think about a year and a half ago, that equated the physical impact and medical effects of loneliness, equating it to smoking 15 cigarettes a day, which is significant. I suspect that if they look at that again today, that the intensity of loneliness is such that it may look more harmful than that. And the second thing that I think a lot about, so there's loneliness and isolation on one hand, and then there's care support on the other hand, which are all the people that provide services and supports to older adults who need them. And some of those folks are paid. The people who work at benchmark communities are paid. This is their staff job. But we have in Massachusetts, and we're just a small state, we have over 850,000 people in Massachusetts who are unpaid family caregivers, people who are supporting family members, good friends, neighbors in those activities of daily living. Those people are balancing their own jobs, their own family responsibilities, their own stresses, while also taking care of someone else. And we really need to think about how to preserve those people. They're running marathons. It's not a sprint. They're in this for the long haul. And they are an enormous part of the hands-on workforce to support people. So that's the second issue that I think a lot about. Let me just stop there because there's so much more to talk about.
Right. No, thank you, Robin. And when you mentioned 850,000 unpaid care workers, I was just part of a panel, the Silver Economy Forum at the global scale, and they're looking at the disproportionate impact on women as caregivers, who then pull out of the workforce probably mid-career, and the impact to their financial health could be, upwards of $300,000 long-term for lost wages and lost opportunities. So I think that this not only is a health crisis, it's also a financial crisis. And so any interventions that you guys come up with could, if it helps people maintain the equilibrium in their life, could have so many more downstream impacts. And so Stephen, I'd love to turn it to you to then talk a little bit about what you're seeing in the caregiver support universe, and what you're seeing as the greatest unmet needs for people to pay attention to.
Totally. Yeah. I'd like to start by just kind of reinforcing and echoing some of what Duke and you and Lawrence and Robin just said about why this is such an important topic, and why people should work on this area. I think, first of all, this is an area that's going to touch each and every one of us. Rosalind Carter, our former First Lady, famously said there are only 4 types of people in this world. There are people that have been caregivers, will be caregivers, are caregivers, or who will need caregiving. And it's not just elder people that are caregiving. 11% of caregivers are millennials, 45% are Gen X. And there are 30 to 40 million caregivers in the US alone today, 10 times that worldwide. As Lawrence says, over 65% of the over 65 area of the population is the fastest growing. So it's going to get worse. And on top of that, you have COVID, which essentially turned all of us into caregivers. So it's going to touch each and every one of us. It could be tomorrow, it could be 30 years from now, but it definitely will touch us. Another reason why this is important is it makes a huge impact. Family caregivers deliver $450 billion of value, and it directly impacts the health outcomes of the care recipients that they are caring for. It literally is the invisible backbone of the healthcare system. And so if you take that away, the whole thing collapses. A lot of people don't realize the impact of that. A third reason why I think it's important is it is just truly one of life's greatest honors. There really isn't anything more meaningful than taking care of a loved one when they are in their greatest moment of need. I shared in a Slack channel a couple of inspirational videos of caregivers Those of us that work with caregivers every day, we get continually inspired every day. So this is a very important area, very important topic. Yet when each of us get thrust into it, we're going to be completely untrained, unsupported, and unpaid. Caregivers, they have the higher likelihood of getting really acute conditions, depression, obesity, really, conditions, hypertension. So that's why it's really important to work in this area to find solutions and ways to support them. Now, the greatest area of unmet need. So what do caregivers do? It actually is the activities of daily living, the non-clinical aspects of care, the so-called social determinants of health that the healthcare system isn't built to support. It frankly is overlooked by the healthcare system. So buying groceries, cooking, cleaning, helping a care recipient get dressed, transferring them physically from place A to place B, arranging medical appointments and coordinating between the care team, just being a companion, helping with finances. So all these activities of daily living is what caregivers are overwhelmed with every single day. And when you look at each of these areas, there's so much potential for technology to help. I can just give you a few examples that I've seen as repeated gaps, but there's just so much here. So for example, financial planning. There's so many solutions out there for helping plan your finances. But caregivers have very unique circumstances, financial circumstances. They have to take care of the finances of the care recipient. So it's a software system to help people plan finances for caregivers to deal with those special use situations. That's a very simple example. I'll just throw out a few others and then pause. But marketplaces, technologies has enabled a lot of scaled marketplaces out there. There are many opportunities to create marketplaces here. There's a marketplace of people that want to volunteer to be companions or to help. And Robin talked about isolation. A lot of elders are looking for companionship. So you can create a marketplace to match people that want to volunteer to help and be companions and people that need the help. There are lots of caregiving supplies. It's, Amazon doesn't have, you mentioned diapers, Danielle. That isn't the place to go for adult diapers. So marketplace is specially tailored for this population for caregiving. That's another example. So those are a couple of the areas that I've seen, but they're literally, that are gaps, but they're literally, if you go through everything that a caregiver does, every single one of those things can be improved 10x with technology.
Thank you, Stephen. And, and I'm listening to you, I just, it's very touching. Thank you for reminding us that caregiving is a sacred task. And it's something that, we should think about in the arc of our own lives, that we'll be called upon to do that for our loved ones. And also, that we should, what is our own future journey look like? And one can imagine growing older with your family, maybe, in a little in-law apartment in the back of the house. You can kind of imagine all these scenarios, and then everything changes when you think about the added dimension of cognitive decline. I mean, that's the piece of this conversation that starts to get really frightening, when it seems like at what point are you no longer able to maintain your own independence, of changes not only in your physical health, but in your cognitive health, and also the whole interaction between you and your family members and the people around you, that could go on for a very, very, very long time. And so we'd love now to hear from your point of view on the, the clinical side and the technology, of ways that we're just trying to understand the brain and the brain health and how we can get ahead of this. And most importantly, how does innovation help in that long period of, cognitive decline?
Sure. Thank you. And I think several of the points that I wanted to make have sort of been touched upon by Robin and Stephen already, both the issue of caregiving and the issue of loneliness. I think are major aspects of why working in aging is so necessary, and why there's so much urgency. I tend to think of aging from a slightly different perspective, though, in that because by virtue of my work and my position, I end up dealing with people at the most sick and the most ill end of the spectrum. So I think there's a way to look at this at the level of the population, or at the level of individuals that are in the early stages and living independently and receiving caregiving, versus people at the most extreme end who tend to be the most cognitively impaired with the greatest physical and support needs, and also with the greatest number and most expensive forms of care. So we know that about 1% of the population who tend to be disproportionately older with severe dementia and multiple medical conditions are actually the drivers of about 20% of all healthcare expenses in the US. Uh, so I would argue that economics is both the most downstream piece of this, as Danielle suggested, but it's also the starting point for prioritizing what has the greatest urgency. I like to divide aging and brain health into sort of two big components. One is people with dementias and people without. And of course, there's commonalities to both these groups, specifically in physical health and things like frailty or loneliness. They cut across these categories. But as a clinician, I find that the way to think about innovation is to really think about the person and their needs first. So one of my favorite quotes is, it comes from a Harvard economist named Theodore Levitt, which is, no one wants a drill. They just want the hole that it makes. And that's been an anchoring quote in that, because my work involves interfacing with a lot of technologists, a lot of engineers and data scientists, an issue has always been kind of bringing people that think differently and in some ways speak different languages to get together and sort of focus on the same problem. And a good way to do this is to start with the patient or the person or the client or the resident, depending on the context. But start with what the problem is that needs solving and then develop a tool for it. Far too much of the work around innovation and aging sort of starts with having a tool or thinking about the technology first. And this is especially common when talking about smartphones, which are devices with so much multifunctionality that the thinking process starts with having this great tool, but then adapting it to fix a problem. And that doesn't always work so well. I think if we keep it person-centered, it's a little harder to get off the ground, but I think you come up with more meaningful, tangible, and scalable solutions. And I think the other piece that's sort of tied into that comment is the importance of people with multiple ranges of expertise working together. This panel is a good example. I mentioned earlier that it's not common for me to find myself in a panel with no other academics. So to speak with a group that has policy expertise and entrepreneurship expertise and expertise with the industry, I think that's a good metaphor for how this work needs to be done, which is people with a very diverse set of skills and backgrounds coming to, this sounds simple, but it's not, but learning to work together, because it's not easy. All of us kind of come at this with a fixed set of skills and a fixed mindset and approaches. And sometimes it involves opening yourself up to feeling stupid, as I frequently do when I talk to my engineering and data science colleagues. So I think from the clinical and brain science perspective, there are huge clinical challenges out there. It's really hard to pick one over the other. But sort of realizing that cognitive impairment, but aging without cognitive impairment come with their own unique but large sets of challenges. But within that, really being able to hone in on a specific problem and then thinking with an interdisciplinary team on how to tackle it. And I think that's the right way to do it. And it's the way that's going to have the largest and most scalable impact worldwide. I'll stop there.
And I agree entirely. And at agency, we have a phrase, we say, design for joy, right? So indeed, you know, these interventions and innovations are going to solve a specific problem. Chances are there'll be some technology baked in. So just for economics or scale or you know, efficacy and so forth. But at the end, it should be desirable, something that somebody wants to use, somebody that when they use it, they don't necessarily feel old, or it's not stigmatizing, or it's not so complicated that it requires so much training on the part of the person who's using it or their care team or so forth. So the framework of, you know, human-centered, absolutely, like the deep empathy for the people that will be using the you know, solution, but also design for joy, right? And so one thing, the other topic we like to talk about is don't waste a good crisis, right? So here we are in COVID, and indeed, every one of us is feeling some accelerated effect here of what it means to be isolated from those we love, isolated from our work and from community, and we've all you know, figured out how to get groceries delivered and all this, you know, just bring services in, this new meaning of home. And it's also on the policy side has allowed for an acceleration of releasing some of these reimbursement codes for telehealth and telemedicine, maybe some of these things that were getting kind of stuck in committee. We're starting to see people saying, all right, it's okay, we can kind of let that go, just so we can start getting some services. So all of that is predicated that there's this, you know, equality of access to technology. And that connectivity is available for everyone in equal measure. And we just know that's not true. So connectivity is one of the biggest challenges that for this hackathon this weekend. So I'd love to just open it up to the teams here, the panelists, like help us understand, you know, where you're seeing like technology that doesn't necessarily have a lot of friction, and then other solutions that you got to think about all of the pieces to make sure that it connects from end to end. And what more do we need? What more creative ways do we need out there so that technology can get into the hands of people who need it? So Robin, I'll start with you.
All right, I will start there. So I'm going to talk a little bit more about the challenges that we're seeing and that have been, you know, exacerbated by the pandemic. And even though it is 2020, believe it or not, if you looked at older adults in this state or around the country, and I can't speak for the world, but I bet it's true in the world, there are lots and lots of people who do not have access to affordable, accessible internet, broadband, choose whatever term you want. And this has some pretty serious ramifications. So many people have access, but it's not affordable. So I hear stories every day of people, older adults on fixed incomes. You know, most of you on the call are not old enough to know that the average Social Security benefit barely will rent you a one-bedroom apartment in a second or third tier city in this country. Not New York, not San Francisco, but in, you know, some of the smaller cities in this country. So if you're on a fixed income, you can barely afford the rent for a one-bedroom apartment. And then you have a cell phone and you choose an affordable data plan. And I hear stories every day from older adults that they will save their data to talk to their family and their grandchildren. And because they're saving their data and it's not unlimited, they're not engaging in televisits for healthcare. They're not doing Zumba classes or exercise classes. They're not using it for other kind of social or educational benefits. So we have a lot of people who don't have access to the internet in an affordable way. And, you know, I think it used to be that electricity wasn't everywhere and wasn't always affordable. And we need to get where access to internet is like access to electricity or water. So we're actually considering a lot of ideas as developers build new senior housing. Maybe that becomes a requirement. So there's many ways to get at it. But for those of you who are looking at innovations that rely on remote monitoring and remote technology, you need to understand that there's a large swath of the older population that is going to face a challenge in using that because they just don't have the access. So that's kind of one thing that I just want to point out. And then the second thing I point out, and this is both an opportunity but also a challenge, is that if you think about the older population, that spans 4, maybe 5 decades, right? People in their 60s, people in their 90s, now people are increasingly living to be 100, 205. They all have very different experience with, skills to use technology. They have different attitudes toward technology. You know, my mother's 91, she's visually impaired. She got herself an iPad, and every family Zoom call we have, I see her elbow. The only thing I see is her elbow because she doesn't know how to use it. And interestingly enough, it's hard for some people to learn how to use this technology unless they are taught by people who are living in their shoes. So for someone who's a little bit visually impaired or who has hearing impairment, they need to be taught by someone who experiences life and technology the way they need to. And so you shouldn't assume that if you've got an app or a remote monitoring system or some other wonderful innovation, that it's going to be usable by everyone who's over the age of 60. People are going to need adaptations and guidance and support in order to make those technologies have the impact that you want them to.
And so, Stephen, as a tech entrepreneur, build on that. Like, what did you have to overcome, or how did you kind of position your solutions for the different categories of users and demographics in terms of accessibility and affordability?
Yeah, I think Ipsit made a couple of points earlier, which I think is really applicable here. One is, you know, you have to focus on the problem, not the technology. You know, we all, you know, I think a lot of participants age group grew up with internet, smartphones. And so it's, I think, easy to make that assumption that you built the app and everybody could use it, but completely not the case. So you have to really focus on the problem, who the users are, and then kind of work from there. And to go along with that, I think Ipsit mentioned the importance of kind of diversity of thought. So making sure that you have a team with all sorts of different skill sets. And so, yes, you have the technologists, but it's also important to have people that have the empathy and the experience of what your customers are going through. And so, you know, if you have that mindset, you know, it guarantees that you won't fall into the trap of building something relying on technology that people won't have the solution, people won't have access to. So I think those are two important ways to make sure you don't fall into the trap. You know, making sure people have the diversity of thought on the team, and you're focusing on the problem and not the solution.
Right. And Ipsit, tell us more about like how people think about using these interventions, and what's the, you know, kind of the openness or the mindset into behaviors that allows an innovation to be adopted.
Yeah. So I think the most important thing to remember about how older adults use technology is that it's very incentive or need driven. Most older adults will not use technology the way younger adults do. So it's not exploratory or trying something because it's cool or incentive or interesting. But if there is a reason for them to use it, and if that reason is made tangible, studies have shown that not only will they use it, their adherence and their way of using it will be, you know, they're more likely to do it the way it's supposed to be done than a younger person might. We often ask that what would it take to get a whole bunch of older adults to adapt to something like telemedicine at scale? The answer, as it turns out, is a global pandemic.
Yeah.
So when it has to be done, they will do it. I think Robin's points about providing a degree of support and education and training is crucial. But I will also say from my clinical service, where we had to get about 1,000 older patients to start using telemedicine more or less overnight. We succeeded far beyond anyone might have imagined. But the reason we succeeded was not because they wanted to get the right kind of geropsychiatric care. We succeeded because they all figured out how to use Zoom, because that's how they attended church services. That's how they stayed in touch with their grandchildren. That's how they were able to communicate with their families. So the work was done for us, but I think it really brings home this lesson of it has to be incentivized in the right way. And there has to be a degree of support and training. I'll make a couple of other points though, which is I think there is an implicit ageism in how we think of aging and technology, and we're all guilty of it. I will start with myself. As an example, when COVID broke, I led an editorial in the American Journal of Geriatric Psychiatry, basically talking about how to prepare for the crisis of aging and mental health that was certain to be upon us because of high mortality and high isolation. As of yesterday evening, there have been published studies in top journals from the US, from Canada, Spain, Italy, the Netherlands, China, Hong Kong, and Taiwan. I may have missed one, finding exactly the same thing. Older adults have the least negative mental health impact of any demographic. Turns out we grossly underestimated their ability to help. And that editorial was written by a bunch of leading geropsychiatrists who, if anyone should be able to predict this, it should be that group. It's just that most people at that age have their reasons for being that way. And if we're going to get them to adapt new technologies or learn new skills for improvement, the onus is on us to incentivize the change, not on them to change it because they're supposed to. I mean, most people hit late life knowing a thing or two and having survived a thing or two. And for the most part, they know what they're doing. We may not always agree, but I think there is implicit ageism in a lot of how we think about this that needs to be accounted for.
That's fascinating. And it's interesting because what we're finding at agency when companies want to kind of commercialize, you think like, who is the actual customer for some of these innovations, right? So maybe the individual is going to use this device. They want to make a purchasing decision based on, does this bring me joy? Does it help me do something that I want to do? Does it make my life easy, more fun? But the older adult child who's caring for their parent, they might want that intervention because it reduces their guilt or their stress, or they feel like, I need to remotely monitor mom and dad just to make sure that, because I can't be there, but that might be viewed as a imposition or surveillance on the part of the elder, right? So the two very different sets of purchasing decisions for the same idea. And then thirdly, when you think about insurance coverage or getting the physicians involved, they might make purchasing decisions based on the efficacy. Am I getting clinical worthy data out of this tracking? Am I getting something that can help in the care and improve the health outcomes of using this tool or intervention? So that point about incentives, I think, is so vital because there's different incentives for different stakeholders across a purchasing decision or the value chain. And oh, by the way, a lot of this is governed by policymakers, right? Like, what about getting video cameras in the homes? And what about privacy laws? And how does that change how we feel about certain things? So I think this is so ripe for so many innovators to kind of explore and push these boundaries. And so I just want to, again, remind everybody on the call, like, please send us your questions. Now that you've heard a little bit about what really motivates each of our leaders here on the panel and what they're looking for and the unmet needs and some of the interesting challenges that are worth solving, please go ahead and put your questions into the chat and we'll make sure that they get addressed. And in fact, one came through. Let me scroll here. I think it's worth for everyone on the panel to respond to this. When you're seeing innovations that are used by older adults like smartphones or their caregivers, how do we think about that? How should somebody, as they're designing something, think about what could be used individually, what could be used for caregivers? How does that expand the potential, really, for a lot of these ideas? Go ahead, Stephen.
Yeah, I mean, so we build a support navigation platform for family caregivers, like you said. And the design challenge has been exactly that, right? We have teams that people build teams, so they bring their personal social circles in help of to support a caregiver in the caring of a loved one. And so the care recipient may be a parent, So, baby boomer, maybe in the 60s, it could be in the 90s, like Robin said, could be on the team or could be not on the team. And then you have the caregiver and all the caregivers, personal social workers on the team. And, those people could be, in their 30s or 40s, or it could be the kids. And so it's a very big range of users in terms of demographics that could be on it. And so, you have to have an excellent design team that can make sure that it caters to, all the different demographics. This has been honestly a real challenge. I think we debate this every day. So I mean, I think most of us are familiar with Snapchat, right? Very comfortable for the millennial demographic, but there's no way my mom can ever figure out Snapchat. And our product team is trying to find that right balance between the two. So it's a lot of constant user testing. It's a lot of usability testing, validating, and responding to user feedback to make sure you make the right call there. But it definitely is a challenge and balance to strike to make sure you can serve that entire spectrum.
And so,
so I just wanted to add, I think that you also need to think about why people want to engage with the technology, right? So my mom will engage with a mobile phone because she needs to get a ride. She needs to get an Uber or a Lyft or some way to get home because she can't drive. That's why she wants to engage with a cell phone. She doesn't use a cell phone for anything else. And yet, if you look at the average cell phone, it's not designed with that as its primary functionality, right? Like if you look at the initial screen, it's not really obvious how to get a ride. And so I think we need to design for what people are motivated by, whether it's to talk to their children, to get a ride, to play poker, whatever it is. And that requires a very in-depth understanding, not just of what the problem is you're trying to solve, but what the motivation is. It's interesting. Some people might wear sensors or agree to have sensors in their home because it means their daughter won't call them 14 times a day. That's a very different motivating factor than wanting to track their A, B, C, and D levels or whatever it is that the sensors are tracking. And you need to understand that in order to make this work.
Yeah, and Ipsit, what are you seeing too? What's like, how do we get the voice of seniors and the folks that you're treating like into this conversation so that they could, more intentionally say, yeah, here's what would work for me, or here, I'd be willing to kind of engage. At what point do you have those difficult conversations with people that you love to say, hey, I really think you need to put this IoT sensor, on your body or in your clothing or in your shoes so that we make sure that, you're healthy and safe. How does that conversation be successful?
For the most part, to start with, you just ask. And it sounds silly, but that's how easy it often is. I think who is asking and how does make a difference. I've found, and my research team has often found that if I bring up something to to a potential research participant, that's one of my patients, I get little to no resistance. Whereas if a study recruiter or someone sort of from the broader research team does it, they do seem to be met with resistance. So I think that question of trust at the outset and transparency about what this is for, I think that matters quite a bit. Beyond that, question of the simple stuff, educating, giving them a reason to sort of see the incentive in taking on the extra effort and letting them know how this is going to benefit them. And then working through the specifics of design. I mean, when there's the opportunity to change design, and it could be the design of the hardware of a technology, it could be the design of an interface, it could be the design of the process of using it, or if this is in the context of a research study of some type, then the study of the design of the study itself. I think design is not one thing, but we have, I think, started to get much better at putting user friendliness and convenience of use at at sort of the top of the wish list. I will say one thing, and this was taught to me by someone I was working with, where this was a person that did not use a tablet at all, and we were trying to get this person to use a tablet, and there was talk about getting them a more senior friendly tablet and which one to use and this and that. And this person said, honestly, I have no interest in using any of that garbage because nobody else uses it. If I'm going to use it, I want to use an iPad and I want someone to take the time to teach me how to use it. And if I can get the iPad, then I know my grandkids are going to help me develop other ways of doing it because now I'm cool. So I think that piece needs to be kept in mind as well, that we often think of senior friendly technologies, whereas using regular technologies, but with that extra effort of training, may go a long way in kind of overcoming adoption challenges.
I'm glad you brought that up because there's a startup that's part of Techstars right now in this new Future of Laundry whole chapter of Techstars that's actually being funded by Melinda Gates because let's see, I think it's Pivotal Ventures is her organization, and she's looking at like these challenges of technology adoption. And one of the companies, in fact, is it's called Candu Technology, and it's simply that. It is kind of getting the geek squad in your home, helping to set up all the technology, but with all the geriatric training, so that you understand, different ways to do that education and that onboarding and so forth with older adults, and the phone, but laying the groundwork for more like those are like gateway technologies to the adoption for more intense technology, like maybe IoT sensors in the home and kind of the video tracking and so forth. So we're seeing that there are opportunities to innovate, not just for the direct application itself, but for the the catalyst application that allows those solutions, right? So an older adult that feels trusting and has some capability now of using tech might be more open to having, let's say, a digital companion robot in their home, or it might be open to having something that, maybe more telehealth interventions and so forth. So I know we've been talking a lot about like human first design for joy and all that, and that's essential. But I do want to also, because this is the MIT hackathon, help us understand places where you have seen technology used in like really surprising, useful ways, and also some technologies that you're seeing on the horizon that give you really a lot of hope and excitement. At agency, we did an event just on voice tech, right? We knew that voice tech in and of itself wasn't going to be the solution, but wow, when you start to have technology where older adults can talk to and get feedback, it starts to open up, the really interesting applications. So what are some of the tech on the horizon that would be really kind of exciting, you think, is kind of opening up some creative new ideas? Stephen, you're smiling.
So, yeah, I'm smiling because you mentioned voice technology. That's what I studied at MIT, and so that was what I spent many years doing. And there's a company out here in Boston called LifePod, which was started by some of the ex-speech workers where I started my career. And they're doing something pretty interesting with voice. So they're essentially creating an Echo. Right now, Echo, you have to talk to it to get it to start. They're working with Amazon, and they've kind of their own version where Stu, the founder and CEO, calls it proactive voice, where it can speak to you. So you don't have to speak to it. And so as a caregiver, you can imagine remotely configuring it to check in on how your grandma or your mom is doing. Hey mom, did you take that medicine? This comes to mind. It's kind of flipping the Echo the other way around, so that you can configure it conversations versus you just triggering it with the magic word. So that comes to mind.
Nice. So, and I'm looking at the time, so we are getting close on time. So please send all of your questions in, or get onto the Slack if you have additional questions. So just super quick then, Robin and Ipsit, just some tech that you're seeing out there that's getting you really excited.
Well, I think from my perspective, the stuff that I find most exciting is the work going around to support family caregivers, and all the people thinking about how to support their needs, because they are our unpaid workforce, and they are the ones that we are very much dependent on, no matter what the condition of our economy or healthcare is. So I'm excited that so many people have begun to understand the situation that these caregivers find themselves in. And in fact, they're not, it used to be that they're mostly women. Now nearly half of them are men, and about a third of them are millennials. So this is a group that knows how to use technology. They're all about it. And so I think that's really exciting.
Beautiful. And Ipsit, from your point of view, from the clinical side.
I like technologies that are as passive as possible and require the person being studied or monitored to do as little as possible. So we've been doing some work with a company and a team that came out wave sensor, where it requires no direct interaction, no charging, no wearing. It's basically a box that's mounted on the wall and plugged into the power main. And what this device can do is it can track motion through how these radio waves bounce off a human body. I think more broadly, technologies that can map motion, and by motion I mean all the way from GPS, which can track movement across entire geographical fields, to passive twitch of an eye or respiratory rate from heart. I think we're only scratching the surface for how much behavioral and functional information we can glean from tracking motion of the whole or parts of the body. I think that's what I'm really interested in and most excited about. And I actually think motion mapping is poised to become the next great biomarker in health sciences.
Oh, that's tweetable right there. Okay. So we covered a lot of ground, and I'm hopeful that this was helpful to all of you who are really hard at work at your ideas, and to like add some clarity to what you're working on, right? So think very clearly, are you looking at something that's more on the prevention side, right? Before there's a kind of a more higher risk or higher clinical setting. So are you more on the prevention side? Are you more on the treatment side? Are you building something that, is going to be something that's get reimbursed by insurance, or maybe it can be paid out of pocket? Or are you building something for more income constrained user, or technology, as we learned, constrained user who may not have access? Are you building something that's for use by an individual, or an individual and their care partner, caregiver, or in a different care setting other than the home, or is it hospital or congregate care setting like at Benchmark? I love this idea of technology. Yes, needs to be advanced, but more passive, not an active or overly complicated use case, because support and training is almost as important as the actual intervention itself. And above all, as we say, design for joy, but pay attention to the incentive. Pull through, that's going to be what makes what you're working on desirable and commercially successful. So with that, I would love to say thank you to our panelists for spending your Saturday afternoon contributing to this wonderful hackathon that's going on all weekend. Thank you to the organizers of the MIT Grand Hack, Hacking Medicine, and to each and every one of you who are really giving it such amazing creative effort. So with that, I will turn it over to Lawrence. So thank you all.
Yeah, and I just wanted to thanks to you, Danielle. Thank you so much to you, to Stephen, Robin, Ipsit, all of you for spending a good bit of your Saturday afternoon with us. So thank you. And thank you to all the teams who are working on the best tracks, track C, and on the future of aging. And I'm really looking forward to the event and the judging tomorrow, and to see what you all come up with. So thank you all. Tanya, or is there anything else we need to do, or are we good?
Nope, you guys are good to go. For
Okay.
all of the participants who are still on, if you do have any questions, I'm sure you guys have your sponsor channel, which all of them can visit, and obviously request any mentors as well.
And if we go to build a company after this and you still want to be in community of these experts, come and build your company over at agency at the CIC, and you'll be connected to a whole community and ecosystem of thought leaders who can help you build, design, and commercialize your ideas.
Yeah.
So we
And
look forward to seeing you around.
And thanks to Benchmark as well for helping to co-sponsor this track. So thank you. Thank